Have you ever stopped to think about the amazing high-speed conversations that are happening inside your body, like right now? It turns out there's this incredible partnership between your metabolism and your lungs, and they're working 24/7 to keep you in this perfect life-sustaining balance. Today, we're going to pull back the curtain and see exactly how they do it. So here's how we're going to break it all down. First, we'll get a handle on what I'm calling the body's pH seesaw. Then, we'll see why your lungs are basically the EMTs of this whole system. After that, we're going to dive into 2 real-world case studies to see this in action, and then we'll wrap it all up by looking at this truly perfect partnership. All right, first things first, we have to understand this core concept, this delicate balance of acid and base in your body. Seriously, it's like a perfectly tuned seesaw, and your life literally depends on it staying level. To really get why this matters so much, let me ask you a question. Your body is constantly juggling things, right? Temperature, blood sugar, blood pressure. But what do you think is the single most tightly controlled thing in your entire body? The answer is the pH of your blood. It's that important. And this is what we call the acid-base balance. See, your body is fighting tooth and nail every single second to keep your blood pH in this incredibly tiny, narrow little window. If it gets a little too acidic or a little too alkaline, things just stop working. Your cells, your enzymes, they all need that perfect balance to do their jobs. So how does the body manage this? Well, here's the secret weapon. Carbon dioxide. You know, the stuff you breathe out. In your blood, it acts like an acid. And because you can change how fast or slow you breathe, your lungs have this immediate, powerful control over a major acid in your system. It's brilliant. Okay, so if the lungs have this superpower to control acid, what happens when something else, like a problem with your metabolism, throws the whole system off balance? Well, that's when they jump into action. They become the body's first responders. And the rule here is just so simple and elegant. If your body becomes too acidic because of some metabolic issue, what do the lungs do? They make you breathe faster and deeper. The goal is to literally blow off as much of that acidic CO2 as possible. And on the flip side, if your body isn't acidic enough, the lungs do the exact opposite. They slow your breathing way down to hang on to that precious acid. It's a perfect immediate reaction. And when I say immediate, I mean it. We are talking fast. This response from your lungs kicks in within minutes and is already making a big difference within an hour. Now, compare that to your kidneys, which also help with pH. They can take 3 to 5 days to fully kick in. Your lungs are the rapid reaction force, no question. Okay, theory is great, but let's see what this actually looks like in a real-world scenario. Let's start with our first case. What happens when your metabolism just floods your body with way too much acid? So picture this, a 22-year-old guy with type 1 diabetes. The problem is he ran out of insulin. Now, without insulin, his body can't use sugar for fuel, so in a panic, it starts burning fat like crazy. The byproduct of all that fat burning, these acidic things called ketones, and suddenly his blood is full of acid. When he gets to the emergency room, the first thing the doctors notice is his breathing. It's described as deep and rapid. There's even a name for it, Kussmaul breathing. Now, this isn't a lung problem. This is his lungs trying to fix the problem. And of course, the lab results tell the exact same story. His pH is 7.28, which is dangerously acidic. His bicarbonate, or HCO3, is low, and that's the key clue that tells us this is a metabolic problem. And look at his breathing, 28 breaths per minute, super fast. The physical signs and the lab numbers match up perfectly. So, let's connect the dots. His body is overloaded with acid from those ketones. His brain's sensors pick up on this dangerous pH drop and basically hit the panic button, sending an emergency signal to the lungs that says, get rid of acid now. So the lungs just obey, going into overdrive to blow off as much CO2 as they can. That Kussmaul breathing, that's his body trying to save its own life. Okay, so now let's flip the script and look at the complete opposite scenario. What happens when the body's metabolism makes it lose too much acid and become too alkaline? Our second patient is a 55-year-old man who's been vomiting for 4 days straight. Just think about what's in your stomach for a second. It's loaded with incredibly strong hydrochloric acid. If you're throwing up over and over, you are losing a massive amount of acid. And losing all that acid does exactly what you'd think. It sends that pH seesaw flying in the other direction. The blood becomes way too alkaline or basic. The medical term for this is metabolic alkalosis. And once again, the numbers tell the tale. His pH is way up at 7.53, which is very alkaline. This time, his bicarbonate is high, which, again, points to a metabolic cause. But here's the kicker. Look at his breathing. It's slow, only 11 breaths a minute. So what's the why here? It's that same beautiful logic, just in reverse. His body knows it's too alkaline. It's lost too much acid. So the brain tells the lungs, hey, stop, we need to hold on to every bit of acid we can get. The body then intentionally slows down the breathing to retain that acidic CO2, all in a desperate attempt to pull that pH back down toward normal. When you look at these two cases together, you really start to appreciate it, right? This is a perfect partnership. It's an unbelievably elegant and intelligent system that's just running in the background, keeping us alive. And really, it all boils down to this one simple truth. It doesn't matter if the metabolic problem is too much acid or too little acid. The lungs will provide the immediate opposite reaction to try and restore balance. It's that simple. So let's just recap this whole amazing process. Step 1, a metabolic problem throws the pH seesaw off kilter. Step 2, the brain's control center detects the danger and sends out an SOS. Step 3, the lungs get the signal and immediately change how fast and deep you breathe. And step 4, this buys the body precious time to deal with the root cause of the problem. It's just a beautiful cascade. And that just leaves us with one final thing to think about. We've just peeled back one layer on one of the body's incredible invisible feedback loops. It really makes you wonder, doesn't it? What other amazing intelligent systems are working away inside you right this second to keep everything in perfect harmony?